Welcome to the Jerry Panel Podcast. This is Eric Wadera.
This is Alex Smith.
And Alex, I see somebody else is in the room with us today.
Today we have a repeat guest. She's waving for the camera. We're on YouTube again. Hello, everybody.
Hello.
We have Rebecca Sudore, who's professor of medicine here in the Division of Geriatrics at UCSF. And she's going to come talk to us today about another PREPARE trial, this time in Espanol.
So we're going to do all about advanced care planning, but before we do that, Rebecca, we ask all of our guests, do you have a song for Alex?
I do. Alex.
I've heard from your team that they wanted a song in Spanish, right? So, Gracias a la vida. And this is in Spanish. I did take some Spanish at some point.
High school?
It's a little... Let's see how we do here. And we're only going to speak in Spanish from now on. Desde este momento, solamente, Heripal en español. Heripal. Gracias a la vida que me ha dado tanto, me dio de luceros que cuando los abro, perfecto distingo lo negro del blanco y en alto cielo su fondo estrellado y en las multitudes la mujer que yo amo. Oh, that was fun.
Oh, that was awesome.
That's great.
So I'm guessing there was a reason we're doing something in Spanish today, and I think that's reason Rebecca, you have an article that was just published, is that right?
That's right. It's very exciting.
On your Prepare for Your Care website and advanced care planning. So I'm hoping that we can chat a little bit about that. But before that, I'm wondering if we could take some big steps back, as really a national, international expert on advanced care planning. And I quite haven't figured out exactly when we talk about advanced care planning, like what are we actually talking about when we mention those three words together?
Yeah, well, it's very interesting because I think that the definition has evolved over time. I think when I started this work, advanced care planning really meant only one thing. Did you complete an advanced directive? And specifically, did you complete one of the check boxes about CPR or mechanical ventilation? And I think to this day, people still think of advanced care planning as only that very small thing. So Terry Freed and I, in 2010, in the Annals of Internal Medicine, published this paper called Redefining the Planning in Advanced Care Planning, which we really took a step back to try to broaden that definition, because advanced care planning actually is many things. It's thinking about what is most important to you. It's trying to identify your wishes and how you want to live your life and what brings your life meaning, and then communicating that to other people, either by having discussions or, for some people, documenting them. So again, advanced care planning is very broad.
So it's not just if your heart were to stop, would you like us to restart it with electricity?
Much broader.
Much broader than that.
Yes.
And it's more than having a living will, durable power of attorney.
Exactly. It's a part of it. And I think as we were talking earlier, when we think about the field of palliative care, hospice is a part of that, but it isn't all of it. When you think about Venn diagrams, it's those advanced directives are a part of a much larger, broader process.
Right. And when we're thinking about advanced care planning, you said the word process. And it sounds like that's a key part of it. This isn't a one-time thing. Like we had the discussion, we're done. Could you say more about that?
Yeah, so Terry Freed has done a lot of work thinking about readiness and things like that for people who are ready to engage in advanced care planning, and I think we found the same thing, just like for, say, smoking cessation or getting engaged in an exercise program. People think about things for a while, they prepare, and then they're actually ready for action. And it's the same thing with advanced care planning. I like to sort of think about, the idea that you're not just gonna sort of hit the double diamond, like run on your first time on a set of skis. And it's the same thing with advanced care planning. You need some help and some preparation, which is what our prepareforyourcare.org website does, and that it helps people wherever they are sort of jump into that process.
Mm-hmm. And we had you on this podcast, well, I don't know, a year ago, something like that, about a year ago,
Yeah.
where you talked about your first Prepare trial. Could you remind folks whom astoundingly may not have listened to or read that podcast or read the article, what you did there?
Yeah, well, that was a really exciting trial for us as well. So we actually conducted that trial in the VA. It was a randomized trial, and it was a comparative efficacy trial, meaning everybody got some form of advanced care planning. One group got our easy-to-read advanced directives. We haven't really talked about that, but they're written at a 5th grade reading level, and they're easy to read. And the other group got that advanced directive, but also prepare. And then we followed people for 6 months, and we wanted to know what would happen. So we found in that trial, and by the way, the thing that was important about that trial is it was patient-facing only, meaning we gave people these tools, and we wanted to know how much bang for our buck could we get by just giving stuff to people.
Mm-hmm.
And we didn't do any interventions with clinicians or the healthcare system. And we found that 6 months later, people really engaged in advanced care planning and were able to do a lot of this stuff on their own. And surprisingly, people in the prepare arm actually had evidence of documentation of advanced care planning in the medical record, like 35% of them did. And with the easy-to-read advanced directive, 25% of them did.
Mm-hmm.
But again, that's just documentation. Again, many people were engaging and having conversations and
Mm-hmm.
thinking about their values and wishes. So that was an exciting study for us.
So why not just end there? That sounds like a great result. Great
We're
journal.
done. Shortest podcast ever. Recap of prior podcasts. Back to this. No?
End this with a song, Alex.
There are many different types of people in the world besides veterans. And much of the work that I have done over the last 15 years have really been in disenfranchised populations and thinking about how can we reach people who might not have access to normal, regular access to medical care, much less medical education and materials. So we know historically people who say are in county facilities or county hospitals and have lower health literacy or who don't speak English as a primary language have really low advanced care planning rates. And really that's because there haven't been materials that have been made with sort of co-creation with them and for them. And so the VA study was really exciting to us, but we knew we needed to go the next route and really see could these materials that were created with and for people at our county hospital, could they actually work?
Mm-hmm.
And we had gotten funding to translate Prepare into Spanish, but it hadn't been tested in that population.
When you say translated into Spanish, do you mean you did voiceovers in Spanish, or what does that mean?
Yeah, so it's much more extensive than that. So it's not just a straight translation. It's like
Didn't use Google to figure out.
we
what
didn't
the-
use Google Translate. No, it was actually a very long, arduous process. I like to tell the story about how even the word advanced directive means there's many different words in many different Spanish-speaking countries, and so even to come up with a word that would make sense on the website just took a long time. So it wasn't a straight translation. There was a lot of cultural adaptation that had to take place, sort of in the wording and things like that. We really wanted funding to be able to reshoot all of the videos, but we didn't have funding to do that.
Yeah.
So it is audio dubbing, but all of that from every single word on every single page and every, we haven't talked about this either, but Prepare is really video heavy that shows people how to do advanced care planning.
Mm-hmm.
All of that had to be sort of recreated essentially for Spanish.
Wow, that sounds like an enormous undertaking. Do you want to acknowledge any funders before we move on? Continue?
Yeah, there were a lot of them. So
Yeah.
there was the National Palliative Care Research Center, there was the PCORI also did that, there was the John and Juana Harmon Foundation Gordon Betty Moore Foundation, the Bechtel Foundation, Tideswell, lots of groups.
Yeah, lots of groups
Yeah.
contributed to this. It's great.
Okay, so really important. It sounds like that in like safety net hospitals with large Hispanic population, that this is often an issue where they're not getting the advanced care planning. What did you do in this study? Like, was it the same exact design as the previous one, randomized controlled comparative effectiveness study?
Yes, it was the same sort of setup. One group got our easy to read advanced directive, either in English or Spanish, and the other group got the easy to read advanced directive plus prepare in English or Spanish.
So there was no usual control where they didn't get
No.
either one of those.
You know, I think because studies have shown that advanced care planning really can help people, we didn't feel like it was ethical to have a control group.
Okay.
And when you say people, are we talking older adults here, people with serious medical illnesses, chronic conditions? Who was in the study?
Yeah, so, you know, oftentimes in county populations, again, because of decreased access, there's accelerated aging. And so we actually, instead of starting at 65, we actually identified people who were 55 years of age and older, had 2 or more chronic or serious medical conditions, and had seen their primary care provider twice in the last year, so we knew they were kind of plugged into care. That was our patient population.
And did you exclude people who at baseline already had engaged in advanced care planning?
No.
No.
And it's a really good question. I think the reason that we didn't is because a lot of the pilot work that we showed, that even people who had engaged in advanced care planning or thought they had engaged in advanced care planning, they learned things with Prepare or the Easy to Read Advanced Directive where they realized, oh, wait a minute, I made the wrong decision. Or, wow, I started this process, but I actually never talked to anybody about it. Or, I completed this advanced directive, but it's sitting somewhere in the back of my file cabinet. And so we actually didn't exclude anyone who reported that they had done this before.
Yeah, so we should talk a little bit about what this intervention was, now that we've talked about who was studied. Can you say more about what Prepare is? You know, what do you do? How do you access it? What are the outputs?
Yes. So, well, I'll just say first that we created these easy to read advanced directives, and sort of as you were saying, just like the VA trial, we thought we were done. But we heard from patients and their families, they really needed help learning the skills so that they could, you know, identify what is important to them and be able to talk to people. It's a tall order to sit in my geriatrics clinic and tell somebody to go out and choose a surrogate decision maker, but how do you do that? How do you start that conversation? And people felt like that's what they were missing. So that's really what Prepare is. It's sort of a 5-step kind of walk-through program that really teaches people skills so that they can identify what's important to them and express those to other people. And so that's what it does. Like I said, it's 5 steps. You don't have to do all 5 steps. We asked people in the trial to do all 5 steps, but in real life, you don't have to. It's free. It's available at prepareforyourcare.org, as are the easy to read advanced directives. And so it's been available to the public since 2013.
And where do they do this Prepare for Your Care?
You can do Prepare for Your Care anywhere you want. You can do it on your phone, you can do it on a tablet, you can do it on a desktop, you can do it at home, you can do it in a group medical visit, you can do it in a clinic.
Where did they do it in your trial, in this most recent
Yes,
one?
so in this trial, and again, because this is an efficacy, not an effectiveness real-world trial, but this was the...
Wait, what?
Yes, so the difference is when you do your first set of studies, oftentimes people will do what's called an efficacy trial, which is the best possible sort of research conditions versus messy real-world effectiveness, what they call it. We're doing effectiveness right now, but that trial was efficacy, meaning we asked people to come into research offices. We showed them Prepare. We asked them to go through the 5 steps. Our study team was available to answer questions, but they basically said, I'm doing work over here. Let me know if you have any questions, and try to simulate as if they were doing it at home. But they did come into research offices.
Got it. Yeah, no, that's an important point. Is there also, so in this study, they engaged in the web-based Prepare version. They were not, you say, watching the DVD at home. We're doing this as part of a group visit.
Right, yes. Other studies have looked at group medical visits and things.
Mm-hmm. And so we've talked about who was studied, what the intervention was.
Was there anything else besides them just getting the prepare for your care? Like, were you, it sounds like it was in a researcher's office, but like, were you contacting the physician, letting them know the outcomes of the discussion, or
No.
was there same thing as the last one where really no physician involvement unless the patient brought it to their physician?
Right, so the idea is that we would give this to patients, and the hope was that they would be activated to then go and bring this up and bring this stuff to their primary care appointment. So after somebody reviewed either the easy to read advanced directive or prepare in the advanced directive, we gave people those things to take home and do with what they wanted.
Mm-hmm.
We set up these interviews 1 to 3 weeks before primary care visit, so that 1 to 3 days before the visit, our team called them to remind them about their visit. People in the prepare group were reminded, hey, you might want to bring this stuff up to your doctor, so there was a reminder in there.
Mm-hmm.
But that's how that worked.
Great. So what'd you find?
Yeah, it's super exciting, I have to say. So we found that virtually every single person in this study, 98% of people who were randomized to the prepare trial, increased their engagement in advanced care planning. So they did some increased form of advanced care planning, whether that was thinking about their wishes, talking, planning, or documenting.
And that, for that question, like, how did you figure out if they were thinking about it? Did you just ask them, are you thinking about it, or was it?
Another great question for everyone who might be watching this, because we actually have validated surveys that pick up advanced care planning engagement. So we've been, as a little aside, because these surveys can be used both in clinical and research opportunities, can actually pick up multiple behaviors in advanced care planning and people's readiness to engage in those behaviors. And this is awesome, but we basically have validated a 4-item version that is able to pick up change. That's not the version we used in this trial, but we since have validated it. It's free. Actually, we're putting it up on the Prepare website so anybody can use it. And we're finding that there actually might be clinical utility in using these 4-item questions, because it can help hone down who's ready to do what. But we also know that it picks up change in response to an intervention, so it's actually really good for research studies.
Mm-hmm.
But that's how we found where people were in their engagement level.
Okay, so 98% engaged compared to 97% in the, compared to what?
I think it was, hang on one second, I think it was 89%, I think, with the, let me just make sure I'm not lying to you. It was, yes, 89% in the easy to read advanced directive, which was also amazing.
That's pretty
Which
impressive.
is pretty darn good.
It's really,
You can give
really
them an
good.
easy to use advanced directive and you get
Yes.
89%, we'll call it 98% of people to engage in advanced care planning to some degree.
Exactly.
Yeah.
That's super exciting to us.
Right.
Especially since, maybe you guys don't know, but we got funding from the Gordon and Betty Moore Foundation to update these easy to read advanced directives in English and Spanish for all 50 states.
Wow.
And they're available for free on the Prepare website.
That's great.
Yeah.
What else? Like, is there changes in documentation?
There are.
But wait, there's
Yes,
more.
There's more. So for those people who need to check off that box about documentation, and there are quality metrics looking at this, so it's really important. There's some reimbursement to hospitals for this type of documentation. It's really important. So again, with these patient-facing tools, we found that people in the Prepare arm, 43% of them had advanced care planning, new advanced care planning documentation in the medical record over 15 months.
Wow.
And the easy to read advanced directive was 32%. So for a behavior that's really hard to change, and when you look at how studies have done in the past, if you just hand somebody an advanced directive and how do they do in primary care, most studies showed between 5 and 20% for patient facing. So this actually more than doubled that.
Yeah.
So,
Yeah.
and I think it also goes back to that thing that if you give people materials they actually can understand and aren't scary, they actually might be able to look at them and read them, fill them out, and do something with them.
Right. Kind of take ownership too. I mean, the idea of this, it doesn't all have to take place in the physician or the social worker office, that this could be done at home, and that they play probably the most important role here in making these decisions.
Right.
And was this working equally well in English speakers and Spanish speakers, or did you see any differences there?
Yeah, I think that was the other thing that was really exciting to us, is that when we looked at interactions, which means splitting it out by language and health literacy and education, we found that Prepare and Easy to Read Advanced Directive worked equally well in English speakers and Spanish speakers, and equally well in people with high education and high health literacy and low education and low health literacy.
So, so what is the difference between this study, called Prepare 2 for short, and Prepare 1? And what did anything you found that is different or surprises you about these new findings?
Yeah, I mean, I really thought that, when you take something like the VA system, which is a little bit more of a universal healthcare system, maybe has some more supports, and has some better, at least right now, documentation abilities. That's changing at the county hospital, but, when the study started, I thought for sure that the rates would be higher among veterans. And when we look at the low health literacy rate in this population overall was 40%, and among Spanish speakers, it was 60%. And then when you look again historically at how hard it is to help, these patients engage in advanced care planning, I actually thought our rates would be much lower, and they were actually higher.
So is that because the follow-up time was longer?
It could be, I think, for a couple of reasons. One, our follow-up time was a little bit longer, and I think, again, because advanced care planning is a process, people can keep increasing sort of over time. So that's one thing. The other thing is that we really spent a long time and really thoughtfully over many years creating these materials with and for these patients and their caregivers. We have stakeholder advisory groups that really helped us sort of through every step of the way. And this was really created so that it was culturally appropriate. And I hope that one of the reasons is that this really resonated with people.
So I got a bigger question, like just going through my mind, what is, like if you had to come up with like the perfect primary outcome here, because it sounded like when I asked about documentation, like, it's important from different quality measures, things like that. It sounded like you're really excited about engagement. Like when you think about when we, let's say, prepare a 3.0 study, and if you had to design a perfect primary outcome, like what would it be? What are we hoping to achieve here with advanced care planning? And how do we measure it?
Well, so it depends upon, there's a lot to unpack there, Eric.
I was hoping for it. What's the answer?
So I think the easy answer, and I will just tell you too, that since I'm involved in like ongoing studies about this, which we can talk about, we're using the 4-item advanced care planning engagement survey, because to me, again, as a clinician, and you guys are both palliative care clinicians as well, at the bedside, if people have engaged in any of this stuff beforehand, it's so helpful. So to me, any increase in engagement, and by that I mean starting to think about their wishes or values, starting to talk to other people, that's really important to me, and I think is clinically meaningful, even if you haven't signed your name on a piece of paper yet and completed advanced directive. So to me, that's most important. I will tell you, and this is why I said it's a complicated question, because we actually completed a study, which Alex was a part of, where we actually asked experts to rate what they thought sort of outcomes for advanced care planning should be. And many of them are things that are picked up in our survey, like talking to surrogates and things like that, and identifying their wishes and goals. But the number one rated outcome.
Please don't say DNR. Please don't say DNR.
No.
Okay, good.
DNR was way down the list. It was like advanced directives actually were number 10 on this list. Number 1 was care consistent with goals. But that's like a whole other show, because that's hard to measure.
It's hard to measure, but that is the holy grail of measurement here, because that's ultimately what we care about with advanced care planning, is does it lead to people getting the type of care that matches their underlying goals?
Yeah.
And that's where we need to head eventually.
Yes.
But science is an incremental process.
Well, I mean, it makes me also think, like, when we think about engagement, because, you know, I think the most challenging situations is, have their loved ones been engaged in their advanced care planning?
Mm-hmm.
Which, I mean, it's great that people are engaged, but if they're actually not talking to anybody, it sounds like that's one of the questions. But if the surrogate is not involved, maybe they're talking to their lawyer or their doctor, but their surrogate isn't involved, like, in the end, it doesn't really matter that much if nobody knows. It's like if a tree falls down and nobody's around.
Mm-hmm.
I mean, it's so interesting that you say that. So, you know, the stats essentially say that 75% of us will need some sort of surrogate decision making at some point in our lives. And I think we know, all of us here, that it's incredibly stressful for surrogates. Studies have shown increased PTSD. These are the people that have to go on living, sort of being in this situation. And I like to say that surrogates are often the sort of part of the equation that is left out of advanced care planning. I think that's, to be honest, it's one of the things that we really baked into Prepare. Because when we were doing our focus groups, that's what we heard. Surrogates were saying these pieces of paper are nice, but we never had these conversations. No one talked to me. I don't know why they chose what they chose.
Yeah.
You know, and I kind of like to tell this story. I think we've talked about this before, Eric, that, you know, you can go to an ICU family meeting and you could have somebody who completed their advanced directive 5 years ago, but the family's still, you know, looking around at each other like a deer in headlights because nobody had this conversation and they don't understand what the form meant or what were they thinking. Or you can have a family that's never had an advanced directive, but they could say, I've been talking about this for the past 5 years and this is really hard.
Yeah.
But I really know what this person wants and what's important to them.
Well, I was actually just talking with Ann Kelly, the social worker on our palliative care team,
Who's amazing.
Who, you know, one of the things that we're acknowledging as far as our team is how well are we proactively including family members in discussions early on, not just when we need them, but actually before we need them to make decisions, to lessen the burden on them and to make sure that we are making sure that care will be consistent with goals. And honestly, I think that is one of the big areas of improvement that we need to do. And I wonder from the same team, from other palliative care teams' perspectives, like, how proactive are we in engaging family members?
You know, we're not doing a good job of preparing.
If there only was a tool.
If only there was some way.
I still feel like probably we are often reacting more than being proactive and preparing.
Yeah, I agree. Yeah.
So one of the things too, just, you know, back to that, you know, not just palliative care, but let's talk about geriatrics and primary care, which is, you know, some of the work that I do. You know, going back to that redefining the planning and advanced care planning, for people who are listening to this, Terry and I actually sort of wrote out, here are some steps you can do in primary care. We know you don't have a whole lot of time, but you can break it up. And one of the key pieces is, it's not only, hey, do you have a surrogate, but what have you talked about with that surrogate, and does the surrogate know that they were chosen? And I can tell you that since I started doing that in my own clinic, you know, I have like more than a handful of people when I've actually called up their surrogate to say, I'm sitting right here in clinic talking to your loved one, and they said that you were the person they chose. They've said no. And better to find out now, like you said, so you have time to prepare and plan, find the right person, or support that person so they feel like they could actually do it.
Oh, this is great. This is where the rubber meets the road. do you use Prepare in your own outpatient practice?
I do. I actually do. And I'll tell you, I don't think it's right for everyone. And I do think, again, being a geriatrician, and not everybody has access to the internet and things like that or feels comfortable. But for those older adults who do, they've been really engaged. Their tablet, their phone, they've shared it with all of their family members. And I think where it's also been really helpful is that some of my, patients will come in with their loved ones and they'll say, I don't know how to start this conversation with my mother or father or aunt or uncle or husband. How do I do that? And I think what's nice about the videos is that part of the website, you can go through it and it's interactive, but there are also what I like to call the movie version of Prepare, where you could just play all of step 1 like a movie, which is about surrogates, or all of step 2, which is about defining your values and goals. And I have found that to be really helpful. If people don't know how to start the conversation, they can always play step 1 and watch it together and then have a conversation.
Yeah.
The other thing I'll put in a plug for is that for free on the Prepare website are Prepare pamphlets, which I like to say are the cliff notes of Prepare. And I print those out and give those out because even if somebody can't get to the website, it really kind of gives you some words that they could say to sort of start these conversations.
This is great. So this is, Rebecca uses it in her clinic. Now we're going to go even one level deeper here. You're really deep here.
Go deep.
Does your mom use Prepare?
Yes. Yes. So I tell the story that the way that I got my mom to start doing advanced care planning is I told her that I really needed help and input about Prepare, and she was a great editor, let me tell you. But by doing that, it was really helpful because we could start talking about it. And now, I think it's really, it's been really helpful. I think that experience really helped her when she was helping my aunt, her sister, when her sister was dying, have these conversations and to be her advocate and, talk to her clinician. And my mom is such a great spokesmodel, but I think we were talking, I'd love to have her be the spokesmodel for Prepare, but she is my mom, so.
You can't really do that.
Okay, let's say I have a primary care clinic or a geriatrics clinic or a palliative care clinic tomorrow, and I'm gonna give this a shot with one of my patients. Can you give me a couple steps that I should do to do advanced care planning with Prepare?
Yes, so I think one of the things you can do is print out the Easy to Read Advanced Directive and print out the Prepare pamphlet. And I think, again, if you go back to that Redefining the Planning and Advanced Care Planning paper, we often make this a lot harder on ourselves than we need to. And you can just sort of start by asking people, have they done advanced care planning or completed advanced directives before? And if they look at you and they have no idea, then you know where you're going. But if they have, then you can have a conversation about, well, tell me what it said on those forms and who have you talked to, and you can kind of figure out what are the next steps that you need to do. And again, an outpatient, you don't have very much time.
No.
So
I'm looking at my watch right now.
Yeah. So number 1, ask them if they have a surrogate, who they would choose. Ask them what they've talked to that person about or what they would talk to them about. Then number 2, you can ask them whether they've thought about sort of what's important to them in their life and their medical care. And if they don't know, give them the Prepare pamphlet and show, send them to the Prepare website.
Great. And it remind me that the end of the Prepare website is an action plan that they bring back to me potentially?
Yeah, so the way that the website is set up, this is before we actually created the Easy to Read Advanced Directives for all 50 states. You can create a summary of my wishes. And so now that the advanced directives are sort of integrated right into the Prepare website, people have a choice. So maybe you're not ready to complete the legal advanced directive, but you're going to go through the website and have a summary of your wishes that can still be used as a template when you're having conversations with your family and friends, and you could still bring that into your doctor. But if people are ready to do the advanced directive, by the end of this year, we'll have the opportunity that's automatically pulled into the Easy to Read Advanced Directives.
Wow. Let's say, so you're saying if I work in Alabama and I have a Spanish-speaking patient, it will potentially at the end of the year auto-generate the easy-to-read advanced directive?
Yes.
And then I bring that into my clinician's office?
Yes.
Holy smokes.
It's
We're going
great.
to have you on for a third time. That is impressive. That is completely like flipped classroom. Everything happens outside the physician's office or MP's office, and they
That's the way it should be.
bring it in.
Yeah.
Well, I think the other thing too, for like snowbirds, so people who say are in New York, in the summer and in Florida in the winter, if you go on and you complete your advanced directive and save, you can switch it over to the different state because all 50 states have their own laws.
Oh.
So there's 50 different types of forms.
This is good.
This is good.
This is the future.
Well, I am just completely impressed by what you're doing. Again, looking forward to having you on a third time.
Yes. Thank you so much, Rebecca. This was terrific.
Thank you guys. This was great.
So where can we find the article again?
It's in JAMA Internal Medicine, and the website's prepareforyourcare.org.
Wonderful. And for anybody, really encourage you to try it out in the next week or two when you have those patients. And leave your comments on the Geripal blog about kind of how that would work for you. And with that, I think, Alex, do you have any other questions?
No, I think we're good.
How about you end us with a little bit more?
A little more gracias a la vida. Gracias a la vida que me ha dado tanto, me ha dado el risa y me ha dado el llanto, así yo distingo dice di quebranto los dos materiales que forman mi canto y el canto de todos que es mi propio canto. Gracias a la vida, gracias a la vida, gracias a la vida, gracias a la vida.
I love it. I love it. I want to thank all of our listeners for joining us in this week's Geripal podcast. Rebecca, thank you for joining us. For our listeners, we look forward to our next podcast next week. If you have a second, please rate us on your favorite podcast software, iTunes, Stitcher, or whichever one you use.
Bye, folks.
Bye.